Hello students, in today's video we are going to study pharmacology of quinolone and fluoroquinolone antibiotics. Now as we all know, antibiotics are the drugs that are used to treat bacterial infections. Now quinolones and fluoroquinolones are synthetic antibiotics that inhibit DNA replication. So by blocking DNA replication, they kill bacteria and are bactericidal. Now look at this structure. This is the structure of 4 quinolone ring. Now molecular structure of quinolone antibiotics consists of this quinolone ring. Now nalidixic acid. Nalidixic acid is a quinolone antibiotics. Now as we can see here, its structure consists of the quinolone ring. Now, fluoroquinolone antibiotics are derivatives of quinolone with one or more than one fluorine substitution. So, this is the structure of ciprofloxacin. Ciprofloxacin is a fluoroquinolone. As we can see, its structure consists of the basic quinolone ring with fluorine substitution on the 6th position. Now let's classify quinolones and fluoroquinolones. Now all quinolones and fluoroquinolones are effective against gram-negative bacilli. That is, they are effective against gram-negative rod-shaped bacteria. Now originally quinolones were synthesized. So first generation consists of nalidixic acid. Nalidixic acid is a quinolone antibiotic that is active against gram-negative bacilli. Now, second generation consists of fluoroquinolones, namely norfloxacin, ciprofloxacin and ofloxacin. Now, in addition to their activity against gram-negative bacilli, they also show limited activity against gram-positive cocci and some low activity against atypical bacteria, that is bacteria without a cell wall. Now levofloxacin is a third generation fluoroquinolone that retains activity against gram-negative bacilli but exhibit improved activity against gram-positive cocci and also atypical bacteria. Now, 4th generation fluoroquinolones include moxifloxacin, gemifloxacin. Now, these antibiotics again retain their activity against gram-negative bacilli and show improved and extended activity against gram-positive bacteria, and they are also effective against anaerobes. Now, here levofloxacin and moxifloxacin are termed as respiratory fluoroquinolones, as these are very effective in respiratory infections. Now let's study antibacterial spectrum of quinolones and fluoroquinolones. Now all these antibiotics are effective against gram-negative bacilli. That is, they are effective against gram-negative rod-shaped bacteria. Now, nalidixic acid is the first generation quinolone that is active against and kills gram-negative bacilli like E. coli, Klebsiella, Proteus, Enterobacter, Shigella, but not active against Pseudomonas. It has no activity against gram-positive and atypical bacteria. So, quinolones are narrow antibacterial spectrum antibiotics. Then second generation onwards are fluoroquinolones that are comparatively more potent with extended antibacterial spectrum. Now ciprofloxacin is the most commonly used second generation fluoroquinolone. It shows increased activity and is effective against a broader and extended range of gram-negative bacilli, including Pseudomonas aeruginosa. In fact, ciprofloxacin is the most potent fluoroquinolone active against Pseudomonas aeruginosa. It shows limited activity against gram-positive cocci It is effective only against Staphylococcus bacteria like Staphylococcus aureus, Staphylococcus epidermidis, including methicillin resistant Staphylococcus aureus. Now, ciprofloxacin is not effective against Streptococcus pneumonia, and thus it is not used for the treatment of respiratory infections. Now, in addition to gram-negative bacilli and gram-positive cocci, ciprofloxacin also shows low activity against atypical bacteria. Now, unlike gram-positive and gram-negative bacteria, atypical bacteria do not possess a cell wall and are intracellular. That means they enter and they multiply inside the cell of the host. Now, ciprofloxacin exhibits some low activity against Mycoplasma, Chlamydia and Mycobacterium tuberculosis. Now, levofloxacin is a third generation fluoroquinolone. Now, levofloxacin retains activity against gram-negative bacilli, but it is less effective against Pseudomonas. Now, it shows increased activity and is effective against a broader and extended range of gram-positive cocci. It is also effective against Streptococcus pneumonia. Now, levofloxacin has good intracellular penetration. It reaches inside the body cells and it shows improved activity against atypical bacteria. As atypical bacteria are the bacteria without cell wall, and these bacteria, they multiply inside the host cells. So, levofloxacin shows improved activity against atypical bacteria like Mycoplasma, Chlamydia, Mycobacterium. Now, since levofloxacin is effective against Streptococcus pneumonia and it is also effective against Mycoplasma pneumonia, Chlamydia pneumonia, levofloxacin is very effective in the treatment of respiratory infections and is known as respiratory fluoroquinolone. Now, moxifloxacin is the fourth generation fluoroquinolone. Moxifloxacin retains activity against gram-negative bacilli. Now, in comparison to the third generation, it has further improved activity and is effective against broader and extended range of gram-positive bacteria, including Streptococcus pneumonia, then beta-lactam and macrolide resistant gram-positive bacteria, and it is the most potent fluoroquinolone against Mycobacterium tuberculosis. Now, in addition to this, moxifloxacin is also effective against anaerobes, and moxifloxacin is also known as a respiratory fluoroquinolone. So, quinolones and fluoroquinolones all are effective against gram-negative bacilli, but as we move from the first generation towards the fourth generation, they show improved activity and enhanced activity against gram-positive bacteria. So, this is the antibacterial spectrum of quinolones and fluoroquinolones. Now, let's study the mechanism of action of quinolones and fluoroquinolones antibiotics. Now, these antibiotics inhibit DNA replication. Now, DNA replication is a process by which two identical DNAs are produced from a single DNA molecule. So, these antibiotics block DNA replication and kill the bacteria, and thus they produce bactericidal action. Now, in order to understand mechanism of action of these antibiotics, let's discuss few important steps involved in bacterial DNA replication. So, now look at this figure. This is bacterial DNA. Now, bacteria possess a circular DNA. So, this is bacterial parent DNA in a relaxed state. Now, this DNA has to replicate. Now, as we know, DNA is made up of two strands. where one strand is wrapped around the other, forming a double helix shape. Now a segment of this circular bacterial DNA is shown here, where both the ends are fixed. Now these ends are shown fixed because the bacterial DNA is a circular DNA. Now it is essential for these strands to separate for replication. So an enzyme called as helicase unwinds the double helical DNA, that is both these two strands of the DNA are pulled apart. So now when the strands are pulled apart, this forms a replication fork. So this is the replication fork. Now this fork has to move in the forward direction so that both these strands could be further separated. But as the replication fork moves in the forward direction, there arises a problem. Now since both the ends are fixed, as it is a circular DNA, during the movement of replication fork in the forward direction, that is during unwinding, this unwinding creates tightening and overwinding of the DNA segment in front of the replication fork, and this tightening or overwinding is termed as positive supercoiling. So this positive supercoiling prevents the further unwinding, prevents a further separation of the two DNA strands. Now this is only a segment of DNA. If we look at the complete circular DNA, this tightening or this overwinding of the DNA causes twisting of the DNA. So this is here shown the twisting of DNA. The DNA twists around itself, and this coiling is called as the supercoiling. So this is the supercoiled DNA. It has twisted around itself, and this twisting or coiling is termed as positive supercoiling. So this relaxed parent DNA now gets positively supercoiled, and now the strands, the two DNA strands, they cannot be separated. Now in order to resolve this problem of positive supercoiling, the bacteria possess an enzyme called as DNA gyrase. Now DNA gyrase has the ability to cut a DNA strand and then to again reseal it. So DNA gyrase acts on a DNA segment. It acts on the DNA segment in front of the replication fork. And what it does is this, that it cuts one single supercoiled DNA strand. Now cutting, as you can see here in this figure, now cutting of the strand relieves strain and further relieves tightening in the DNA strand. So this prevents positive supercoiling, and once the tightness of strand is removed, DNA gyrase again reseals the cut DNA strand. So DNA gyrase prevents positive supercoiling and relaxes DNA so that the replication fork could keep moving in the forward direction and the two DNA strands could be completely separated for replication. Now at the end of every DNA replication, two interlinked daughter DNAs are produced. So there is another enzyme called as topoisomerase 4. Now this topoisomerase 4, it cuts both the DNA strands and it separates the interlinked daughter DNAs. So enzyme DNA gyrase as well as topoisomerase 4 are essential for DNA replication. Now quinolones as well as fluoroquinolones inhibit primarily bacterial DNA gyrase in gram-negative bacteria and prevent DNA replication, thereby they produce bactericidal action. While in gram-positive bacteria, fluoroquinolones mainly inhibit topoisomerase 4. So, fluoroquinolones primarily target and inhibit DNA gyrase in gram-negative bacteria. This prevents relaxation of positively supercoiled DNA so that the two DNA strands could not be completely separated, and thus the DNA remains positively supercoiled and it further gets damaged, and this damaged DNA is digested by enzyme exonucleases. On the other hand, in gram-positive bacteria, fluoroquinolones mainly target topoisomerase 4. Now, inhibition of topoisomerase 4 prevents separation of replicated interlinked daughter DNAs, and this arrest or this prevents the multiplication of DNA. So, inhibition of DNA gyrase and inhibition of topoisomerase 4 prevents DNA replication, kills bacteria and produces bactericidal effect. Now, major target of nalidixic acid, ciprofloxacin and levofloxacin is the DNA gyrase, while moxifloxacin has very good activity against gram-positive bacteria and it mainly targets topoisomerase 4. So, this is the mechanism of action of fluoroquinolones and quinolones. Now, let us discuss pharmacokinetics and therapeutic uses of different generations of quinolones and fluoroquinolones. Now, first antibiotic is the nalidixic acid. It is a quinolone and it comes under first generation. Now, nalidixic acid is administered orally and it is well absorbed on oral administration. It has a half-life of around 8 hours. Now, it is poorly distributed in the body tissues and thus it is not used for systemic infections. It is not used for the treatment of systemic infections. It is partially metabolized in the liver and it is excreted in the urine. Now, nalidixic acid concentrates in high concentration in the urine and thus it is used in the treatment of non-complicated urinary tract infections. Now, as already discussed, all quinolones and fluoroquinolones including nalidixic acid are effective against gram-negative bacilli. Now, next antibiotic is ciprofloxacin. Ciprofloxacin is a second generation fluoroquinolone and it is the most potent fluoroquinolone against Pseudomonas aeruginosa. Now, Pseudomonas aeruginosa is a gram-negative bacilli. Now, ciprofloxacin is the most commonly used fluoroquinolone. It is administered orally as well as IV. It is well absorbed on oral administration. Now, antacids, drugs like sucralfate, iron salts reduce absorption of all fluoroquinolones including ciprofloxacin. So, administration of fluoroquinolones along with these substances should be avoided. Now, half-life of ciprofloxacin is around 3 to 5 hours. Ciprofloxacin is very well distributed and it has very good penetration in the body tissues. However, it reaches in low concentration in the cerebrospinal fluid. Around 20% of ciprofloxacin is metabolized in the liver. Now, very important, ciprofloxacin inhibits enzyme cytochrome P450 and thus it inhibits metabolism of drugs that are metabolized by this enzyme. For example, drugs like theophylline, caffeine and warfarin. And ciprofloxacin is primarily excreted in the urine. Now, as discussed, Ciprofloxacin is active against gram-negative bacilli, including Pseudomonas. It shows limited activity against gram-positive cocci, mainly Staphylococcus. However, it is not effective against Streptococcus pneumonia. And since it is not effective against Streptococcus pneumonia, it is not used in the treatment of respiratory tract infections. It also shows low activity against atypical bacteria like Mycoplasma, Chlamydia, Mycobacterium tuberculosis. So, ciprofloxacin is used in the treatment of infections caused by gram-negative bacilli, like urinary tract infections caused by gram-negative bacilli, then treatment of non-penicillinase producing Neisseria gonorrhea and penicillinase producing Neisseria gonorrhea. It can be used as an alternative to ceftriaxone or azithromycin in the treatment of cancroid. Now, cancroid is a sexually transmitted disease caused by gram-negative bacilli Haemophilus ducreyi. Then ciprofloxacin is very effective in the treatment of bacterial gastroenteritis caused by susceptible gram-negative bacilli. It can be used as an alternative to cephalosporins like ceftriaxone, cefotaxime, cefoperazone in the treatment of typhoid fever. It's very effective in the treatment of bone, soft tissue, gynecological and wound infections caused by resistant gram-positive staphylococcus and gram-negative bacilli. And high cure rate has been observed with ciprofloxacin in osteomyelitis, that is in the bone infections, and also in the joint infections. Now, in addition to this, as a second line drug, it can be used as a component of therapy used for the treatment of multi-drug resistant tuberculosis. Now, ciprofloxacin is also effective in the treatment of septicemia, that is infection of blood caused by gram-negative bacteria. It is also used in the prophylaxis or in the prevention of gram-negative infections in neutropenic, cancer or other susceptible patients. Now, topical ciprofloxacin is found to be effective in the treatment of conjunctivitis caused by gram-negative bacilli. Now, conjunctivitis is a eye infection. Now, next fluoroquinolone is the levofloxacin. Levofloxacin is a third generation fluoroquinolone. It is administered orally as well as IV. It is well absorbed on oral administration. It has a half-life of 8 hours. Now, levofloxacin has a very good penetration in the body tissues. It is not metabolized and it is excreted unchanged in the urine. Now, as already discussed, levofloxacin is very effective against resistant gram-positive bacteria like Streptococcus pneumonia. It is also effective against atypical bacteria like Mycoplasma pneumonia, Chlamydia pneumonia, and therefore levofloxacin is primarily used in the treatment of respiratory tract infections like community acquired pneumonia, then exacerbations of chronic bronchitis. It is also effective in sinusitis, then in the treatment of pyelonephritis, prostatitis and other urinary tract infections. It can also be used in the treatment of skin and soft tissue infections. Now, the next antibiotic is moxifloxacin. Moxifloxacin is a fourth generation fluoroquinolone, and in comparison to other generations, moxifloxacin has the highest activity against gram-positive bacteria. Now, moxifloxacin can be given orally or IV. It is well absorbed when given orally. It has a long half-life of 10 to 15 hours and has very good tissue penetration. Now, unlike other fluoroquinolones, moxifloxacin is 70 to 80% metabolized in the liver and it is also uh, um, not excreted in urine, but it is excreted in the bile. Now, as already discussed, it retains activity against gram-negative bacilli, and it shows improved extended activity against gram-positive bacteria, including Streptococcus pneumonia, and it is also effective against anaerobes. Now, moxifloxacin is also a respiratory fluoroquinolone and is very effective in the treatment of respiratory tract infections like pneumonia, bronchitis, sinusitis, otitis media. Now, moxifloxacin is not effective in the treatment of urinary tract infections. So, after discussing the classification, mechanism of action, then antibacterial spectrum, pharmacokinetics, and uses of quinolones and fluoroquinolones, let's now discuss their adverse effects. Now, these antibiotics can cause gastrointestinal adverse effects like nausea, vomiting, bad taste, anorexia, that is loss of appetite. Then central nervous system adverse effects like confusion, insomnia, exacerbation of psychosis, depression, somnolence, that is drowsiness, and seizures. Now, consumption of these antibiotics can cause photodermatitis. So, avoid exposure to sun and UV light during treatment with quinolones and fluoroquinolones. Then cardiovascular system adverse effects. Now, fluoroquinolones like ciprofloxacin, moxifloxacin can produce QT prolongation. Now, QT prolongation occurs due to irregular heart rhythm. So, these drugs should not be prescribed with antiarrhythmic drugs that themselves cause QT prolongation like quinidine procainamide. Now, in addition to this, these antibiotics can cause abnormal growth of cartilage and bone, and thus they should be avoided in pregnancy and in children below 18 years of age. Now, a few cases of tendinitis, that is the inflammation of tendon, and tendon rupture have also been reported. So, this is in brief on pharmacology of quinolones and fluoroquinolones. Please note, information provided in this video is only for academic informative purpose. For use of these antibiotics or for the treatment of bacterial infections, consult your physician. Now, antibiotics should not be consumed without consulting physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.